This woman is heavily pregnant and she has severe pneumonia. She's having trouble breathing and we're racing to get her to hospital.
As soon as somebody says a mother's struggling for breath, the alarm bells go up.
Her life depends on this man, a can-do tradie turned doctor.
You've got to be a little bit resourceful, not afraid of anything. Women, when they're delivering, they can lose a lot of blood in a very, very short time and they can die right in front of you.
Spectacular and wild, these islands speak of a different world in a distant time. For generations, little has changed. Contact with the outside world is minimal. We're here to meet Dr. Barry Kirby as he's about to head out on his island rounds. He first came to the Milne Bay area 30 years ago to work as a builder after hearing his father talk about his war experiences.
You know, he'd always say, oh, Barry, if you ever get a chance, you know, go to PNG. It's a great place, good people. Where are we going there? I had no idea it was so close to Australia. right on our doorstep, you know. This is just a completely different world. Yeah. Ready? We're going to do this fast, OK?
At an age when many Australians are considering retirement, Barry is just getting started.
So we want somebody down there who's really packing it nicely, OK? We've got twice as much gear this time as we had last time. So we may finish up putting some on here and even some on the roof.
After starting university in his 40s to study medicine, his life now revolves around helping the mothers of Papua New Guinea.
Quite often, women do not get the respect they deserve. And women actually carry this country. I believe that. They're strong women, they bear the children, they work the garden, humble, not assertive, and put up with a hell of a lot.
PNG is one of the most dangerous places in the world to be a mother. The lifetime risk of dying in childbirth is about 1 in 30, compared with 1 in 10,000 for Australian women, mostly because the villages here are so isolated.
Unfortunately, that's where it all goes wrong. That cultural practice of delivering in the villages is I think, is at the core of why Papua New Guinea has such a high maternal death rate.
Through a simple initiative, Barry has managed to lower the maternal death rate in this area by a staggering 78%. And now he wants to pass on what he's learned to others. Emergency nurse Kila Kupere is making this journey for the first time.
Yeah, this is going to be very challenging for me. It would be nice to just go hit the waves and, you know, see what people experience.
Okay. Do a hard left. Hard left around. There's shallow water down there. At the end of the day, when I can't do this any longer, it's people like Keela that are going to take this forward. You know, this is a PNG problem, and we want to come up with PNG solutions, and we want PNG people doing this. You know, I'm limited now. I'm sort of almost dinosaur stage, you know, and some women like Keela have got to take over.
For the next 2 weeks, the MV Losisi will be our home. We leave Alatau off the eastern tip of Papua New Guinea and head for the D'Entrecasteaux Islands.
Hello, doctor.
Hey, how are you? Nice to see you again.
Here in Alusalolo, 3 nurses look after about 5,000 people.
We're dropping off some more baby bundles. Do you have any left, or are they all finished? They're all finished. Yeah, it's always been a hairy trip, this one.
Yeah, what's that? That left log there is...
Yeah.
It's these baby baths full of goodies that are making the difference, enticing women down from the mountains and into the clinics. While nappies, soap and baby clothes might seem like basic items, for women who own virtually nothing, they're a rare luxury. The bundles have doubled the number of women coming to the clinic to give birth.
So when they have a supervised delivery, when they get into trouble, they've got skilled staff there to deal with it. And they'll save a life. If you have that problem up in the village, you may not survive it. And that's as simple as it is. Did you bring your clinic book with you?
Yes.
Thank you. Just come in here. Okay, my name's Barry. I'm a doctor from Alatau.
It's already been a long day for Barry and Keela, and now 34-year-old Vinka has turned up.
She's having her 6th baby, but she's had 2 previous postpartum hemorrhages. So that makes her a very high-risk mother. Looks like she'll probably deliver tonight, but we'll see how we go. Good, Anna, good. Hey, gotta push this out very fast, okay? Can I have a towel on the belly, please? Yep. Okay, baby. That's it. Come on, mama. Okay, yeah. Oh, congratulations, mama. Baby girl. Girly. Okay, rub that up vigorously. Okay, we'll just feel for another baby here. Okay, I think we're right. Okay. Mama, can you just hold the baby for me? Okay, can we have some 10 units oxytocin, please, eh? Straight in IV.
The team is relieved. There is no bleed.
Okay, can you get that in fast for me? Here, my friend. Here's something for you and... All right, for you and the baby and mother, okay? Things in there for the baby and for the mother.
Well done, Barry.
Hey, no, Kia, you did very well. Good on you, thank you. Great team effort.
Yeah.
Beautiful.
Things don't always go so well.
And we got the boat in safely, that's the main thing.
The next day, we head to a nearby island where a woman recently died in childbirth.
This is what we've got to do. I mean, sadly, every death is going to teach you something. And if you don't investigate it, you may be missing out on something. That's the way I see it. Morning. Pleased to meet you. I'm very sorry that you lost your wife 2 weeks ago. I'm very sorry. Yeah. So we've just come to find out what happened. All right, so see if we can prevent it happening next time, okay?
The village birth attendant explains what went wrong.
This mother was there struggling and she was actually moving her legs, I guess trying to move her position around to try and push the placenta out. But she was bleeding. Was Judith lying down? Was she sitting?
Judith bled to death. Her retained placenta caused a preventable tragedy.
If she'd been down in the health centre, Judith would still be alive. And Piros, you would still have a wife. No, it's all right, I'm all right, yeah.
Judith's death takes Barry back 25 years.
Yeah, it's pretty sad, isn't it? Pretty sad.
to when he was a builder in the Highlands with a secret ambition.
You'd think, you know, it'd be great to be a medico, it'd be great to be a doctor or a nurse and be in a place like this and have a little clinic. And I thought, oh, that's a stupid idea, you know. 40 years of age, I mean, you know, come on, you know. And I thought, get those crazy thoughts out of your head.
Then came a chance encounter that he's never forgotten.
I just drove past this, what looked like a sack on the side of the road. And moments later, I said, no, hang on, that's a woman. I said, well, I'll take her into the hospital. I'll put her in the car.
The woman had been sick for months and was dumped on the roadside by villagers who thought she was cursed.
We started to talk as best we could. Obviously, she couldn't talk my language, I couldn't talk hers. And she had the most beautiful smile, lovely white teeth. And I sort of just looked back and I went, wow, you know, what a beautiful lady.
Later that night, she passed away.
Well, you know, it's... you know, I think that was the final straw. That was the final straw. It was... you know, I was quite comfortable. I got rid of all those thoughts of being a doctor, and all of a sudden, here it is again, heaven's sake. I thought, well, that's it. Okay. You know, if a guy needs a message, I mean, you know, that was it. And I thought, well, okay, I've got to go back. I'll have to go back and I'll try and do medicine.
Having grown up in country New South Wales and struggling through high school, Barry spent the next 10 years becoming a doctor.
If I was going to succeed at this is what I had to do. I really worked hard at it. I can't even believe now how focused I was, and I'm sort of still a little bit focused, actually. That same drive and passion is there. It's never gone. Yeah, it's in...
back through here.
It's inland, you know, the health centre, you can't see it.
Dio Dio lies on the swell-battered west coast of Goodenough Island, a treacherous stretch of water.
What makes it so difficult to get to?
Look, you've got fringing reef, and then you've got this onshore surf onto a rocky beach mixed with sand. You know, it's just... it's a place where you can damage your boat, basically, and your boat is your lifeline in this place.
It's a decent walk to the main village, especially hard for Barry with his bung hip.
Well, I can't remember it being this far in, but anyway. I knew it was a fair walk in from the beach.
Barry was the last dim-dim, or white person, to visit here. That was about 4 years ago.
These are little kids here. They're really, really excited. You people are dim-dim.
What is the dim-dim?
Dim-dim are white people. Yeah. Papua New Guineans, you see, brown skin, light, black skin. So when you people come here, we're very excited to see your faces. Thank you for me putting me in the camera.
Dio Dio may be remote, but it's the centre of activity for this corner of the island. Beyond, small villages dot the rugged terrain. All depend on Dio Dio and its humble health centre.
180 mothers coming.
That's right.
So you must be pretty good.
Marilyn is one of the community health workers.
Most of our people right out behind the mountains, they die due to giving birth.
Yep.
Most of them. So you're coming here to encourage our mothers to come here and give birth at the health center.
The whole success of Dr. Barry's operation depends on getting pregnant women down from remote mountain villages into the community health centres where they can have a safe birth. The problem is some of these places are up to a day's walk away. Normally, Sister Marilyn will go out and check on these mothers-to-be, but she hasn't been able to for a few months because of flooded rivers. Today, we are going to head out and try to make contact.
Having done this trek before, Barry's opted to stay behind this time, and Keela's starting to understand why.
Yeah, just after crossing the river, it's kind of reality just set in, having to experience the strength of the current here in this river flowing and how hard it was to cross this river. Stepping on the stones, it's slippery. The current is flowing against your legs, and being a woman, it just set me in the place where, I began to feel how a pregnant woman would feel, having to bear the weight of pregnancy and then coming to the nearest health center.
That is really steep.
In the baby dish.
After 5 hours, we finally arrive and meet Pristis, who's heavily pregnant with her third child. She's overwhelmed by our sudden appearance.
Nappies, baby nappies.
Twice already, she's had to trek down to the health centre while in labour.
How was that walk with your last pregnancy? Did anyone help you?
Unay fufu, gaito no di ileminda wow. Okay, she says that while she was in labor, her mother-in-law and her mother helped her all the way down to the labor ward. It's my second daughter.
Local elder Rachel explains that here on Goodenough Island, time is a different concept. The onset of labour is often a surprise.
They don't go to school and they don't know really when they are giving birth. In our village, even though they are pregnant, but they always work, garden, carrying water, firewood. Sometimes they deliver on the road, sometimes in the house. Oh, it's really hard. Hard for them walking down from here to the hospital or aid post. It's really hard.
Soon, Pristis will make the journey once again to Dio.
Now I'm going to check you to see if you have any
Oh, thank you, sister.
Right.
Thank you, sister. All right, and there is no tear there. All right, so.
The next day, the staff in Dio get some very realistic training, even down to the fake blood.
The idea is to let's try and make it a bit scary for us, okay? Like it normally is. Okay, we're just gonna slip baby of Angela in there. By the way, we call our model Angela.
This is Mother Angela.
Hey, sister, I want to push. Sister, please, help me. What are you going to do now? Hey, sister, please, sister, get it out, get it.
Little push.
Yeah, sister, yo.
Okay.
Oh, yo. Okay, now we're going to rub it up.
Since I was here 4 years, nobody came in here to do training. And this is the first time in my 4 years Dr. Barry walked in to do this training.
That must feel good.
Yes, and I'm proud about it.
Not too good, not too bad, just good enough. I learned.
We're heading for our last port of call, the market village of Wailagi. Here, Barry has built these waiting houses for mothers-to-be.
Very few women will deliver on the day you tell them they're going to deliver. And that's why we build the waiting houses, so they've got somewhere to stay. They're bringing all these gifts for the patients because a lot of them come from a long way away and don't have enough food or firewood to stay here for more than a few days. So, yeah, it's amazing to see it.
But there's no time to relax and enjoy the scenery. We're soon off again after news comes through of an emergency on a nearby island.
You right? Okay, all yours.
Barry, what's happening?
I don't know, mate. We just got a call from Kalakala. We're over at Wailagi, about 20 minutes away across the bay. Pretty rough out there, and we're just racing over here to find out what's going on. Hello. Oh, sorry. And what's your name? Estai. I'm Dr. Barry. Pleased to meet you.
Heavily pregnant and suffering from pneumonia, Pastai will need to be moved to the only nearby clinic with oxygen.
And this is baby number?
3.
Number 3. All right. Okay. Okay, look, all right, I have one serious patient here who needs oxygen. Okay. You ready to go?
Come in the front.
Okay, got it there. Keep holding it. Hold it. Just go comfortably, but fast. What we need is hold it up there, mate.
With bad weather setting in, Barry is now desperate to get across the strait before dark.
We need a few more people out there. I bring some people.
Okay, please come help.
Get a foot around there.
What's your feet?
Foot around there. That's it. Good. Oh, yes.
On dry land, Pastai is rushed to the clinic and stabilised. But Barry thinks she needs more serious help. With no reception, he drives to higher ground to make a call.
There is no communication here. I'm out on a mountaintop here, mate. Can we get the chopper over here at first light to pull this woman out? Bolu. Good enough. Which is quite bad enough at the moment.
So is she able to
We'll see.
climb up?
Up this, in here.
Oh, in there.
In this one. For a village woman to sit in a $2 million chopper and get a ride into Alotau, I think that's going to be like you and I flying to the moon.
We later learned that Pastai was diagnosed with tuberculosis, but gave birth to a healthy girl.
This is why you do this kind of work.
Yeah, I guess so. Yeah. It's great. We going? Going. Got to go back to Wallagi, mate.
More to do?
Yeah, plenty more to do.
Back in Wailagi, Keela's class on resuscitating newborns is already paying off for this new mother, Josephine.
And she went into labour around 11 p.m., had a baby, and the baby was born flat.
The baby girl wasn't breathing. Thanks to the training, community nurse Jerry was able to revive her.
When we had that last night's case, we are able to resuscitate that child, and we are confident to do that.
It's amazing because we came here, did the training, and the scenario was presented in the night, and they were able to apply their skills. So it was really timely, and that what we are doing is actually working.
I always call them the forgotten workforce. I mean, they are heroes, yeah. Yep, and sometimes they get very little recognition for that. If these people weren't there, many more people would die. A lot of this is just a lot of basic care, but if they don't do it, the baby will die. If they don't treat their infections in the people who are there, they go septic and they die. So in their context, within their community, the community thinks they're heroes.
We are all heroes, yeah. Because we are human beings, we do things, we see things, we do the right thing for the benefit of our people.
I'm just a real doc, really. I mean, it's my job to help these mothers out. That's what I see my job as. So you do whatever that takes.